Shared decision-making is a concept that we have where the patient is an active participant in determining their medical care. And there's been probably a shift in how medical care has been given to a patient or how the decisions have been made. Whereas years ago it may have been a situation in which the doctors told the patient what treatment they should undertake. We now look at it as the patient is the most active participant in this and needs to have input into what treatment seems right for them. There is a Center for Shared Decision-Making located on the main level of the hospital, and patients can go in there at any time, but very often we direct them. And from the Spine Center itself, we have a form that we can give people that allows them to review one of the videos that we have on some of the more common spine operations. They can go in, review the video there, or check out the video, and there's a counselor there to help them with decision making. They have a number of resources available as well for them to review information on the disease and or the treatment. The videos are probably one of the most common, and they include information on the disease itself. They have anatomical pictures, and they talk about outcomes in terms of how people do with or without surgical treatment. A lot of the shared decision-making that we refer people to has to do with surgeries, although some of the diagnoses don't have to do with surgery explicitly. So they get an idea of what their condition is, the various ways to treat it, and how people do after the treatment. With a lot of spine surgery, the choice for surgery is not one of having a harm occur if surgery is not done. It's a matter of pain relief. But surgery is an invasive procedure and there are risks associated. So it's a balance between how much pain is one having, how much difficulty is one having, and how much one is willing to risk in order to relieve it. So we can look at 1,000 patients and say if they undergo a surgery for a herniated disc, 800 of them will do very well. But that doesn't tell us how the one patient will do, and that comes down to a very individual set of opinions and values and beliefs. And the videos, the counselor are meant to help people try to weigh those pros and cons and determine if surgery is the right choice for them. And for one patient it may be the obvious choice, for the next patient it may not be the best treatment alternative for them. Shared decision-making, I think, is instrumental in weighing the balances, the pros and the cons, and letting people set their own realistic goals as to what a surgery might offer them given their symptoms. Most every patient that I've had comment on the shared decision-making told me how valuable it was to them. Very often we hear that patients are confused about what to do. I often hear a comment that I'm not a doctor, and I think some patients actually would like for us to just tell them what to do. But it's hard for us, and consequently I'm sure it's very hard for them to make these decisions. And I think the information that we have at hand and the counselors that we have are very good at helping them think about the process and arrive at a decision that they're comfortable with. Most of what we do, especially in the spine center and spine-related disease, is not a situation where a patient has to have a certain treatment. It's an option for treatment, just like physical therapy, just like an injection. And while physical therapy doesn't have a lot of risks with it, surgery does, and you need to factor that in. And many times people, through whatever information they've picked up on the internet or through friends, they hear a particular view of surgery, that it was the best thing in the world or that you should never have it. And it's often a skewed view, and through no one's fault that occurs. And we need to try to bring that back into the middle and let them understand both sides of the equation.